Now let us discuss about 2023 ICD-10 coding guidelines for Chapter 9, Part 3. Chapter 9 deals with diseases of circulatory system. In the current session, we will complete the hypertension topic. Now coming to hypertensive cerebrovascular disease. For hypertensive cerebrovascular disease, first assign the appropriate codes from the category I60 to I69. The categories I60 to I69, they deal with cerebrovascular diseases. So, in order to code hypertensive cerebrovascular disease, first you need to assign appropriate code from the category I60 to I69, followed by appropriate hypertension code. Here, let us briefly see what are the descriptions of the categories. I60 to I62 deals with non-traumatic intracranial hemorrhage, whereas I63 deals with cerebral infarction. All these codes are further expandable. I65 to I66 deals with occlusion and stenosis of pre-cerebral and cerebral arteries not resulting in infarction. And I67 and I68 deals with other cerebrovascular diseases. I69 series deals with sequelae of cerebrovascular disease or late effect. Now, if you see under the cerebrovascular diseases heading in the tabular list, you can see use additional code to identify the presence of alcohol abuse or dependence. And that means whenever you are coding cerebrovascular diseases, you need to check for these cases and code the additional codes. If the patient has alcohol abuse or dependence, if the patient has exposure to environmental tobacco smoke, then you need to code Z77.22. History of tobacco dependence should be given by Z87.891. Hypertension, that is also included. So whenever you are coding cerebrovascular disease, if patient is having hypertension, additionally you need to code the hypertension code. Apart from hypertension, occupational exposure to environmental tobacco smoke can be given by Z51.31. Tobacco dependence can be seen in the category F17, and tobacco use can be given by Z72.0. There is excludes one node, that is these two codes should not be coded together, that is traumatic intracranial hemorrhage, which comes under S06 category. Now let us see an example. Hypertensive patient presents with cerebral infarction of right carotid artery due to thrombosis. Patient is an everyday current smoker, smokes up to 6 cigarettes per day. Patient was advised on smoking cessation and medications were refilled. So what are the appropriate ICDs here? First is patient is having cerebral infarction of right carotid artery due to thrombosis. So the first code would be I63.031. That is cerebral infarction due to thrombosis of right carotid artery. Followed by patient is hypertensive. So essential hypertension code I10. Then patient is a current everyday smoker. That is given by F17.210. Nicotine dependence, cigarettes, uncomplicated. So three codes are appropriate for this scenario. Now coming to hypertensive retinopathy. It comes under the subcategory H35.0. Background retinopathy and retinal vascular changes should be used with a code from category I10 to I15. Hypertensive disease to include the systemic hypertension. And the sequencing is based upon the reason for encounter. It can be either hypertensive retinopathy can be PDX or hypertension can be PDX depending upon the reason for encounter. Let us see an example. Hypertensive patient presents for regular follow-up. Patient is having hypertensive retinopathy of left eye. Patient was advised to reduce the intake of salt and compliance of medication has been reinforced. Medications are refilled. Here is coming for regular follow-up. But the patient has hypertensive retinopathy of left eye and patient was advised to reduce his blood pressure by reducing the intake of salt and being compliant to medication. So here, reason for visit is essential hypertension. So first I-10 will be coded, followed by H35.032, hypertensive retinopathy of left eye. Now let us discuss about secondary hypertension. Secondary hypertension is due to an underlying condition. Whenever we are coding secondary hypertension, two codes are required. One to identify the underlying etiology and one from the category I-15 to identify the hypertension. Sequencing is determined by the reason for admission or encounter. Under I-15, that is secondary hypertension, in the tabular list, you can find code also, underlying condition. It is not mentioned that code first. So I-15 can be given as PDX and you need to code also the underlying conditions. Depending upon the reason for visit, either the condition will be the PDX or the secondary hypertension. Now let us see an example. Acromegaly with secondary hypertension seen for hypertension management. Here patient is having acromegaly with secondary hypertension, but patient is seen for hypertension management. So PDX will be I-15.2, hypertension secondary to endocrine disorders, and followed by E22.0, acromegaly or pituitary gigantism. Let us see one more example. Hypertension due to systemic lupus erythematosus. And if the patient presents for the treatment of systemic lupus erythematosus, then systemic lupus erythematosus will be coded first, M32.10. Systemic lupus erythematosus, organ or system involvement unspecified, followed by I-15.8, other secondary hypertension. Now coming to transient hypertension. Hypertension transient. Transient means temporary. Assigned code from category R03.0. Elevated blood pressure reading without diagnosis of hypertension unless a patient has established diagnosis of hypertension. Whenever there is temporary increase in the blood pressure, if the patient is not having hypertension, then you can code this code. But if the patient is having hypertension, you need to code the hypertension code only. And next, gestational or pregnancy-induced hypertension without significant proteinuria. This also comes under transient hypertension. This is given in the category O30. Or pre-eclampsia for transient hypertension of pregnancy, O14. There are three categories under transient hypertension: R03.0, O13 and O14. For pregnancy-related hypertension or gestational hypertension, we'll make a separate video. There will be so many topics to cover in that. So as of now, just focus on hypertension transient. There are three codes: R03.0, O13 series and O14 series. Here you can see hypertension transient, elevated blood pressure without diagnosis of hypertension can be coded by R03.0. Gestational or pregnancy-induced hypertension without significant proteinuria. This can be coded for hypertension in pregnancy, transient hypertension in pregnancy or gestational hypertension NOS. That is given in the category O13 series. The high blood pressure that is greater than 140/90 during the later part of pregnancy, that is 20 weeks of gestation, after 20 weeks of gestation, without the presence of protein in urine. Next is pre-eclampsia for transient hypertension of pregnancy. This is given by O14 series. Here you can see the various codes of gestational hypertension or transient hypertension in pregnancy. O13.1 to indicate gestational hypertension without significant proteinuria first trimester. O13.2 indicates second trimester. O13.3 indicates third trimester. O13.4 indicates complicating childbirth. O13.5 indicates complicating puerperium. O13.9 indicates unspecified trimester. This must be coded for gestational hypertension NOS or transient hypertension in pregnancy. Let us see examples. A 45-year-old male present patient by name Chris has been diagnosed with elevated blood pressure. Chris does not have a history of hypertension. Report the appropriate ICD 10 cm code. He does not have hypertension but is diagnosed by elevated blood pressure. So the appropriate answer is R03.0, elevated blood pressure reading without diagnosis of hypertension. Let us see one more example. A 33-year-old pregnant woman presents with gestational hypertension and patient is 24 weeks pregnant. So patient is having gestational hypertension and the weeks of gestation are 24 weeks. This comes under second trimester. From 14 to 28 weeks, it comes under second trimester. So the appropriate codes are O13.2, gestational or pregnancy-induced hypertension without significant proteinuria, second trimester, followed by Z3A.24, weeks of gestation, 24 weeks of gestation. Let us see one more example. A 30-year-old woman is admitted with severe pre-eclampsia in the 25th week of pregnancy. Code the appropriate ICD 10 cm diagnosis codes. So the first code is O14.12 to indicate severe pre-eclampsia second trimester, followed by Z3A.25, 25 weeks of gestation. To next guideline, when what should be code when hypertension controlled and what should be code when hypertension is uncontrolled. Hypertension controlled. This diagnostic statement usually refers to an existing state of hypertension under control by therapy. Assign the appropriate codes from category I10 to I15 hypertensive diseases. Coming to hypertension uncontrolled. Uncontrolled hypertension may refer to untreated hypertension or hypertension not responding to current therapeutic regimen. In either case, assign the appropriate code from category I10 or I10 to I15 hypertensive diseases. In simple words, there is no separate code for uncontrolled hypertension. Whether it is controlled or uncontrolled, you need to code the respective codes from I10 to I15. Now coming to hypertensive crisis. Assign a code from the category I16, hypertensive crisis, for documented hypertensive urgency, hypertensive emergency or unspecified hypertensive crisis. Code also any identified hypertensive diseases. So when we are coding hypertensive crisis, first you need to code I16 series followed by I10 to I15 to identify the hypertensive disease, and the sequence is based upon the reason for encounter. And usually whenever hypertensive crisis is there, that will be the PDX because that needs immediate attention. Now you can see here various codes. Hypertensive crisis is categorized into hypertensive emergency, hypertensive urgency, hypertensive emergency and hypertensive crisis unspecified. Hypertensive urgency is given by the code I16.0, whereas hypertensive emergency is given by the code I16.1 and hypertensive crisis unspecified is given by the code I16.9. Coming to hypertensive urgency definition, a severe increase in blood pressure without corresponding organ damage. Hypertensive urgency is defined as a severe increase in blood pressure without corresponding organ damage, whereas hypertensive emergency is defined as a severe increase in blood pressure with the corresponding organ damage. So when there is organ damaged along with severe increase in blood pressure, it is considered as hypertensive emergency. Whenever there is no organ damage along with severe increase in blood pressure, it is considered as hypertensive urgency. Hypertensive emergency will take the medical necessity. It will take more medical necessity when compared to hypertensive urgency. And hypertensive crisis unspecified is given by I16.9. Now let us see an example. A 60-year-old presents to ER with sudden onset of left-sided weakness, severe headache, slurred speech, left facial droop, and increased blood pressure. The readings are 200 by 176. Patient had a chronic hypertension but was not adherent to his prescribed medications. CT scan of head demonstrated right basal ganglia hemorrhage with shift. Patient was immediately admitted to inpatient setting. And the provider diagnostic statement is listed: right basal ganglion hemorrhage with shift with hypertensive emergency. So the first code will be I61.0, non-traumatic intracerebral hemorrhage in hemisphere subcortical, followed by I16.1, hypertensive urgency. Hypertensive urgency occurred because of the cerebral hemorrhage. So here cerebral hemorrhage, intracerebral hemorrhage is coded first because this is the reason for admission. Then followed by hypertensive emergency I16.1, then I10, essential hypertension to indicate chronic hypertension. And the CPT is 99285 because of high medical decision making. This is a ED visit for evaluation and management of patient which requires a medically appropriate history and examination and high medical decision making because patient has been admitted from the ER into the inpatient setting. That increases the complexity. And it is hypertensive emergency, not urgency. Because it may provide immediate threat to life, you can code 99285 for this particular scenario. Now coming to pulmonary hypertension. Pulmonary hypertension is also itself a very big topic. Here we are not going into details. As of now, the pulmonary hypertension is classified to categories I27, other pulmonary diseases. And for secondary pulmonary hypertension, you need to refer I27.1 and I27.2 series. Code also any associated conditions or adverse effects of drugs or toxins. And the sequence is based upon the reason for encounter except for adverse effect of drug. When coding an adverse effect of drug, first you need to code the nature of adverse effect followed by appropriate code for adverse effect. That is the exception. Whenever we are coding adverse effects, first you need to code the condition followed by the adverse effect code. And for pulmonary hypertension series comes under I27. For secondary pulmonary hypertension and pulmonary hypertension NOS, you can refer I27.1 and I27.2. We will make a separate video on pulmonary hypertension very shortly. Let us see an example. For example, if during an encounter with a patient regarding problems associated with rheumatoid arthritis, your provider also discusses the patient's shortness of breath associated with secondary pulmonary hypertension and caused by the rheumatoid arthritis. You would sequence first rheumatoid arthritis followed by I27.21, secondary pulmonary arterial hypertension. Reason for visit will be the PDX. Here patient comes for the treatment of rheumatoid arthritis. But the provider also discusses patient's shortness of breath associated with secondary pulmonary hypertension that is caused by rheumatoid arthritis. So the sequence would be M05.5 series followed by I27.21. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.